I lost my little brother Michael in April of 2010. He was 13 years old. I knew from Michael's best friend he was being bullied in school to the point where on the day he died, a couple kids followed him into a local record store and made threats. According to my mom, Michael was also struggling with his identity. He had come out as bisexual to her a few months prior, and he was terrified of what our family would think of him. I got the call on an otherwise eventless weeknight. It was my mom, and she was panicking because my brother was missing. I heard fear in her voice as she told me they'd had a fight the previous evening before he went off to his friend's house to sleep over. He should have been home hours ago. He wasn't answering his phone. I tried not to panic myself and suggested maybe he was just walking around town biding his time before he came home. After all, I'd done the same thing at his age. In the moment after I hung up with my mom, I realized my brother probably needed to talk to his big sister, so I tried to call him. It went straight to voicemail. An hour later, my mom called back. I knew right away that things were not okay. Her voice was flat and emotionless. I asked if Michael was all right. "No," my mom said. "He's dead." Those words, the worst 2 words I've ever heard, caused me to drop to the floor with the phone in my hand as a feeling of numbness spread over me. It was like my body knew it had to turn off anything resembling emotion in order to survive what was coming next. At some point, after learning Michael had died, my mom had tried to take her life too. In the morning, I called out of work indefinitely. My dad and I had to plan the funeral ourselves. It was surreal. We had to go to the funeral home, pick out a burial plot, pick out a casket. The funeral took place on a perfect spring day in May. My mom was still in the recovery unit. As the Reverend spoke in beautiful platitudes, I cried uncontrollably for the entire service, holding on tightly to my boyfriend's hand on one side and my dad's on the other. Why wasn't I there? I could have done something to help him. I was his sister. If only I'd known how bad things truly were for him.
It's important that educators know about youth suicide because suicide is the third leading cause of death for people in the high school age range. It's the second leading cause of death for young people across the below 24. And so knowing about that and knowing what the signs are is incredibly important. Former Surgeon General David Satcher said that it's the most preventable form of death in the U.S. today, and more recent Surgeon Generals have confirmed that thought. The reason why we believe that suicide is preventable is that we know that the majority of people who die by suicide have an underlying mental illness. About 90% it's believed. And those mental illnesses are treatable. And if we can get people the support and the treatment that they need, they don't have to suffer and they don't have to die.
When thinking about how to better support young people that may be thinking of suicide, it is important to understand what factors make a young person more or less likely to consider or attempt suicide. In this module, we will take a look at the risk factors, warning signs, and protective factors. Risk factors, characteristics or conditions that increase the chance that a young person will consider, attempt, or die by suicide. Risk factors are found at various levels, at the individual level, family, and community. At the individual level, risk factors include genetic disposition, mental disorders, and personality traits. At the family level, risk factors include cohesion or dysfunction. At the community level, risk factors include availability of mental health services. Risk factors may be fixed, those things that cannot be changed, such as family history of suicide, or modifiable, those things that can be changed, such as depression. Warning signs or indicators that a young person may be in danger of suicide either immediately or in the near future. Warning signs are only applicable to individuals, whereas risk factors are found in individuals, families, and communities. Being able to tell the difference between a risk factor and a warning sign for suicide is important. If you observe a warning sign for suicide, you know that immediate action may be required. Whereas a risk factor for suicide is an indication of individual, familial, or community changes that may need to be addressed over time in order to decrease risk. Protective factors. Characteristics or conditions that reduce the likelihood that a young person will consider, attempt, or die by suicide. Protective factors, like risk factors, can be found at the individual, family, and community level.
Risk factors for suicide are things that increase the probability or possibility that someone might struggle with suicidal thoughts or behaviors. So when we think about risk factors, there's some significant categories, and some of them I've mentioned, but things like psychosocial factors, like what's happening in the person's life. Have they had a significant loss? Have they experienced a traumatic event? Are they experiencing something that they're really struggling with that is impairing their ability to cope in some way? Are they struggling with a chronic medical condition that might cause them to be in chronic pain? Do they have access to lethal means? Now, this is a really important one that isn't always thought of easily, but access to means really can make a significant difference in whether someone lives or dies if they are struggling with suicidal thoughts and behaviors. The way someone thinks, their cognitive style, can make a difference. Are they a black and white thinker? Are they able to adjust? Are they the kind of student that says, if I don't pass this test, I'll die? So when we think about risk factors for suicide, we often talk about the two most prominent risk factors being a family history of suicide and previous suicide attempts. But there are a range of other risk factors that can contribute to increased risk. Things like medical disorders that are causing chronic pain, things like psychosocial factors, including being bullied or being a bully, history of trauma, things like clinical factors. Certainly the majority of people who die by suicide struggle with some underlying mental illness, most often depression, but there are many other illnesses that people struggle with as well, including eating disorders, including bipolar disorder, and a range of other disorders as well. One of the things that's really difficult about depression in particular is that not only is it itself a significant risk factor for suicide, but it also makes the likelihood of engaging in behaviors or things that are also risk factors increases. So the likelihood of someone engaging in isolating or engaging in non-suicidal self-injury increases when someone's struggling with depression. Depression is certainly a significant risk factor for suicide thoughts and behaviors, and it's important to know a little bit about what depression looks like. Depression doesn't always look like someone just being withdrawn or crying, and I think a lot of people believe that is what they're always going to see. Very often, depression looks like somatic complaints, stomach aches, headaches. There are a lot of different things that people might see that could be indicators that someone is dealing with depression. It's worth asking. They're not always, but if it's a significant change from someone's baseline from how they normally behave, it's worth looking into and trying to get some more information. And if they're showing warning signs specifically about suicidal thoughts or behaviors, it's definitely worth asking. So when we think about warning signs, we think about indicators that something is going on for someone. So there are certainly warning signs that someone's struggling, whether it's depression or some other mental illness that might be happening for them. So if someone is writing about or drawing about or talking about death in any way, it's really an important thing to follow up and ask, what's going on? If someone is giving away possessions or talking about not being around for important events in the future, if they're putting their affairs in order, if they're saying goodbye, telling people how much they've meant to them, these are really important things to be aware of, to take notice of, and to respond to as soon as possible. So often it's important to think about the differences, and one helpful way of doing that is to think about something that we know better. Like a risk factor for heart disease is smoking or high blood pressure, but a warning sign of heart disease would be something like chest pains or shortness of breath. So when we think about warning signs for suicide, those are indicators that something might be about to happen, that someone really might be thinking actively about ending their own life. So for every risk factor that might exist for someone, there are an equal number and perhaps more protective factors. And for every student, that may look different, but what are the things in their life that they have that are worth living for? And so really finding things that support that student, that make that student feel like they belong in some way, that they're connected in some way, and that they're supportive. We know that certainly having things that they identify as reasons for living, things that they're passionate about, that they can connect with, are really important. Having connections with other people, having someone that they feel like they can talk to and confide in. We often hear from students that if they had someone to talk to, that's all they're looking for, someone who could ask them if they're okay and really listen to the answer. One of the most pervasive myths about suicide is that if you ask someone if they're thinking about suicide, that you might plant the idea in their head. And there has been so much research showing that this is just not the case. That in the vast majority of cases, if you ask someone who is thinking about killing themselves, that they're going to be so relieved that someone understands how badly they feel. It doesn't necessarily mean that they're going to tell you, but that at least someone gets it, that someone gets how much they're struggling. On the other hand, if someone isn't thinking about suicide, it's not likely that someone's going to start to. We've never once heard of a story of someone saying, someone asked them and they thought, well, I hadn't been thinking about it, but that sounds like a good idea. We're evolutionarily wired to stay alive. And for someone to be in a place where they are so desperate and struggling so much to be thinking about ending their own lives, that's not a decision that they come to lightly because someone else suggests it. So if you're seeing these risk factors and warning signs in students that you're working with, please don't ignore them. If you are able, ask the question. Ask the student, are you thinking about killing yourself? If you're not able to ask that, you can still ask them, are you okay? How are you doing? What's been going on? And if you really feel like you need to ask about suicide, but you can't do it, find someone who can. Don't just ignore it. If you're concerned about a student, how do you ask? We recommend that if you can, that you ask straight out, that you ask someone if they're thinking about killing themselves, and that if possible, you use the yes word. But if you don't feel comfortable doing that, you can certainly start out asking indirectly. There's a number of different ways to do that. Have you ever wished you were dead? Have you ever wished you could go to sleep and not wake up? You can certainly normalize it and say, sometimes when I hear students talking about being in as much distress as you are, they tell me that they've thought about killing themselves. Have you ever thought about something like that? The point is that you want to ask it in a way that feels authentic to you. Students have radar for authenticity, and they're going to know if you're really not wanting to hear the answer. So the one way we really recommend not to ask it is not to say, "You're not thinking about killing yourself, are you?" Because the answer to that is no, no matter what they really are struggling with. And if you know yourself well enough to know that you are not someone who's going to be able to ask that question, find someone who can.
Remember, asking a young person whether they are suicidal is important. If it makes you uncomfortable to ask the question, find a colleague that can. If you can and do ask the question, be prepared for the answer. In order to better prepare yourself to respond to a suicidal young person, you should know your school's policies and know who within your school you should refer the young person to. If you are concerned about a young person harming themselves or someone else, contact your local emergency service provider. As long as your safety is not being compromised, do not leave the young person alone until help arrives.
The idea is that by being trauma-informed, you're going to approach students as if there's a reason for why they're behaving the way that they're behaving. And if we assume that people have a reason why they're behaving the way that they're behaving, that behavior makes sense and is trying to tell a story, then we're going to be much more likely to get an answer about what we can do to help, and much more likely to approach people in a way that's not going to re-traumatize them, but is really going to provide some support and help them to feel like they're heard and they're seen.
Remember, when intervening, you should 1. Identify that a young person is at risk. 2. Ask the young person directly, are you suicidal? Are you thinking about killing yourself? If you can't ask the question, find someone who can.
We're not asking anyone who's not a counselor to be a counselor. Once you find out any information, or even if you just suspect or concerned, follow your school's policies. Talk to the person that is the most appropriate to really know and to respond to those concerns. Find out who can be the best person for that student to follow up with, and really make sure that someone is following up.
Remember, it is important to know your school's policies and protocols and who within your school you should refer a suicidal young person to. After referring a young person for additional supports, either within or outside the school, follow up. Caring may save a life. As you watch the school-based scenarios, practice identifying risk factors, warning signs, and protective factors in young people that are at risk for suicide and self-injury. Think about the ways in which you can ask, intervene, and refer a young person to get the support they need.